If you go through that process, you only have to get 51 votes to get it passed in the Senate. The trick is you can't use that for any kind of legislation. All the provisions within the bill have to somehow relate to the budget and spending. They have to have spending implications. And they can't raise the deficit. If they raise the deficit, then you need 60 votes again. That's why the Obama administration spent so much time devising a plan that looks the way it looks. It's kind of a funny plan. First of all, it involves a bunch of cuts to Medicare, which basically means it's going to reduce how much it pays doctors and hospitals. Now, arguably, that might be a good idea. One of the things that worries people a lot about that plan is if you reduce how much you pay doctors and hospitals, they might just say, we're not going to take care of Medicare patients anymore. Or some of them might drop out. But one of the ways they were able to make it budget neutral, or actually get to the point where it looks like it's going to save money, is by cutting those payments. The other thing they did is they actually delayed implementation of insurance expansions until 2014. So the law that was just, the bills that were just passed by the House and the Senate and are going to be signed by the President in a couple of days, they changed some things right away. They get rid of what are called pre-existing conditions. Are you familiar? Anybody know what a pre-existing? Okay, so you've read about this stuff, right? Only for kids. So basically, if you're a child, if you're under the age of 18, you can't be denied insurance coverage because you're sick. And that's going to happen right away. The other thing that's going to happen right away is people on the Medicare program, people 65 and over, are going to get some additional payments to help them cover their drug costs, because right now the drug coverage in the Medicare program is very limited, and it's going to help bolster that. But most of the really big things in the bill, expanding the Medicaid program to cover more poor people, the insurance mandate, which basically says that if you can afford it, you have to purchase health insurance, right? And that's the big provision in this bill. It basically makes health insurance mandatory in the same way we make car insurance mandatory. And that's one of the funny things about the debate right now, is that everyone's talking about how unconstitutional and un-American it is to force people to buy insurance. We force people to buy car insurance all the time. You can't register a car, drive a car, without buying insurance for it. So there's precedent for this. But if you're poor, or if you're sort of lower income, we also have subsidies. So that if it's just too expensive for you to buy insurance, this bill will also provide you with some government subsidy to help it along. The difficulty with all of this stuff is it doesn't happen, potentially, until there's going to be somebody else in the White House. Because we're going to have two elections. We're going to have what are called midterm congressional elections, where all the members of the House and about a third of the members of the Senate are going to be up for re-election later this year. And that could change the makeup of Congress quite a bit. 2 years after that, Barack Obama comes up for re-election. If his popularity rebounds because the economy's doing better and people are happy with other things, maybe he'll be re-elected. Or maybe the Republicans will put up another idiot. That's always possible too. But as it stands right now, the man has an approval rating of about 41% in the country. And that's not great. We also have an unemployment rate of over 9% in the U.S. Whenever the economy is doing poorly, the incumbent president is voted out of office. It's the easiest way to predict it. You know, basically people don't like being unemployed. What a shock. They like to have jobs. They like to be able to pay the rent and eat and those kinds of things. And so if the economy turns around and he is reelected, the probability that the thing that was just passed this week will actually be implemented. People will actually be required to purchase insurance. People who can't afford it will really get these government subsidies, and all these other things will happen. You might see it become a reality. But at this point, it's a long way off. It's 4 years from now, and we may have a completely different government in place. And if we do, it's possible that all of this will fall apart. But the reason they had to delay implementation was not that they had to spend 4 years thinking about how to do this. It's not a complicated law. Law goes into place and says you have to buy insurance. If you don't buy insurance at the end of the year when you go to pay your taxes, you have to pay a fine. It's very simple. They actually did something just like this in Massachusetts a couple of years ago. In fact, ironically enough, there was a Republican governor, Mitt Romney, in Massachusetts when that approach was adopted. But you get funny politics in the place. So anyway, as you can tell, I mean, there are several things. There's no question that what you get within the U.S., although I will say a lot of the horror stories that you've heard the president and members of Congress tell, and they're genuine horror stories, about people with pre-existing conditions being denied coverage, or people who didn't perhaps fill out their insurance form completely, who are then have their insurance removed after the fact, or people who go into bankruptcy because they can't pay their hospital bill. Those are all true stories. They're very, very serious. One thing to note about those insurance practices, though, they don't actually apply to most Americans. The reason they don't apply to most Americans is if you have some kind of group health insurance, those things are not allowed. It's only on the individual insurance market, which is still a minority of the people in the country covered by the individual insurance market, where you get, and you don't actually get this in every state. One thing to note is that insurance is regulated in the U.S. at the state level. This is primarily a state function. The reason it doesn't matter for most people is that most people who get their insurance through a large employer, the large employer isn't purchasing insurance. It's kind of a funny fact. The large employers self-insure. So my former colleague at Columbia, Jack Rowe, ran for many years Aetna, which is one of the large insurance companies. And he would tell you that 2/3 of his business, he was not providing insurance. He was just processing paper. So imagine you're IBM. I mean, what is insurance? Insurance is you accept the risk that if somebody gets sick, you're going to pay the bill, right? And so you take in premiums, and it's a bet, basically. I look around and I go, what are the odds? I look around, okay, we've got a bunch of young, reasonably healthy-looking people, except you've been in Manhattan, so that's bad for you. But for the most part, young, healthy-looking people. The odds of any of you needing major surgery in the next 12 months, relatively low. Now, a few of us are older, so we're old and sickly now, so the probability that we will have to go into a hospital is a little bit greater. But if we are all purchasing insurance as a group, right, we can pool that risk. It's the logic of social insurance that you see in most countries. That's essentially what the employers are doing. But they are the ones absorbing the risk. They pay out. But if you're IBM, or if you're Microsoft, some other large company, you don't want to have to hire a bunch of people to pay doctors and hospitals and deal with the paperwork associated with that. So what do? You contract it out. You go to an insurance company that does that for a living and you say, listen, here's what I want you to do. I want you to sign, my employees up, give them a bunch of plans that they can choose from, give them an insurance card. I want you to deal with the bills, but we're going to accept the risk. We're self-insuring. If you do that,